Hi, this is Liz Haddock from Social Work Exam Strategies. This video will review the most frequently tested therapeutic theories on the licensure exam. Trauma-focused cognitive behavior therapy. TFCBT is an evidence-based treatment approach for children, adolescents, and their parents or caregivers to overcome difficulties related to traumatic experiences. TFCBT was originally geared toward helping children who were the victims of sexual abuse, but its scope has widened to include children and adolescents who have experienced a single or repeated experience of sexual, physical, or mental abuse, or who have developed post-traumatic symptoms. Cognitive behavioral therapy is a form of psychotherapy where the main goal is to modify dysfunctional behaviors, emotions, and thoughts. CBT is rooted in the idea that the way you perceive situations influences the way you feel, and that you have the ability to change your thought patterns to feel better. CBT is shown to be effective in treating anxiety disorders, depression, substance abuse, PTSD, bipolar disorder, and eating disorders. Solution-focused. Brief therapy, also called solution-focused therapy, is a short-term, evidence-based therapy that places focus on a person's future and present circumstances and goals rather than past experiences. As the name suggests, solution-focused brief therapy is future-focused, goal-directed, and focuses on solutions rather than on the problems that brought clients to seek therapy. Miracle questioning is a common technique in solution-focused therapy. It's designed to help you identify your goals while leading you to create manageable steps to achieve those goals. During this therapy, the social worker asks questions to help the client visualize a desired future and take small steps toward positive change. For instance, the social worker may ask the client, "What would be different if a miracle solved your problem tomorrow?" which helps the client to articulate their vision for positive change. The task-centered practice approach is a method that aims to achieve change through accomplishing specific objectives and tasks. The social worker and client work together to set and break goals into smaller, more manageable steps. For instance, the social worker may assist the client in creating an action plan for finding employment, which may involve updating their resume, networking, and applying to a certain number of job openings weekly. Gestalt therapy is an approach to psychotherapy that helps clients focus on the present to understand what is actually happening in their lives at this moment and how it makes them feel in the moment, rather than what they may assume to be happening based on past experience. Gestalt therapy can be beneficial for many individuals, especially those who struggle with the following: depression, anxiety, low self-esteem, relationship difficulties, low self-efficacy, physical difficulties such as migraine headaches, ulcerative colitis, and back spasms. People who may benefit most from Gestalt therapy are those interested in working on their self-awareness, but may or may not understand the role they play in their own unhappiness and discomfort. Logotherapy is a form of psychotherapy developed by Viktor Frankl, a psychiatrist and Holocaust survivor. Frankl believed that humans are motivated by a will to meaning, which corresponds to a desire to seek and make meaning in life. Logotherapy is a therapeutic approach that helps people find personal meaning in life. It's a form of psychotherapy that is focused on the future and on our ability to endure hardship and suffering through a search for purpose. Feminist therapy focuses on gender and the challenges and stressors that women face due to stereotyping, bias, discrimination, oppression, and other factors that threaten their mental health. Change occurs by recognizing and disempowering social forces while also empowering the client. Therapists and patients examine the various ways unequal power has impacted the ability of women to grow and succeed. Therapists may encourage patients to engage in social activism as a method of achieving empowerment. The therapist recognizes that with every symptom, there is also a strength. The therapist helps the client recognize that she is her own rescuer. The therapy promotes equality in the therapeutic relationship. Dialectical behavior therapy is a modified version of CBT. DBT is used as a tool to teach emotional, behavioral, and thought patterns that are commonly associated with dysfunction. Most frequently used to treat individuals with a borderline personality disorder. The main goal of treatment is to teach people how to live in the moment, improve relationships, develop healthy ways to cope with stress, and regulate emotions. Used to treat intense emotional swings, impulsiveness, confusion about self, and suicidal behavior. Teaches clients mindfulness, emotion regulation, interpersonal effectiveness, and self-management. Narrative therapy is a psychological approach in which the therapist and the patient work together to adjust the stories one tells about their life in order to bring about positive change and improve mental health. Change occurs by externalizing the problem and creating a new narrative that emphasizes the client's competencies and strengths. For example, when treating an individual who has had legal problems, the therapist would encourage the individual to see themselves as someone who made mistakes rather than as an inherently bad criminal. Narrative therapy focuses on the relationship between the client's experience and the interpretation revealed in the narrative. The social worker focuses on how people tell their stories rather than the accuracy of the account. An interactive psychotherapy technique used to reduce psychological stress. Eye movement desensitization and reprocessing aims to reduce trauma symptoms by changing how memories are stored in the brain. The therapist leads the client through a series of bilateral eye movements as they recall traumatic or triggering events in small segments until those memories no longer cause distress. Harm reduction is an approach to treating substance use problems that does not require patients to commit to complete abstinence. Instead, an array of practical strategies are used to reduce the adverse health and social consequences of substance use. The harm reduction approach aims to change behavior according to the goals of each patient, whether that means moderation or complete abstinence. Let's test our knowledge. I'll read a question and give you a few seconds to select your answer. If you need more time, press pause and resume when ready. Question number 1. What tasks are appropriate for a social worker using a strategic approach in family therapy? A. Developing specific interventions for each problem. B. Taking on a non-directive role within the family. C. Conducting a comprehensive assessment of each family member. The correct answer is A. Question number 2. A client has been attending therapy for 2 weeks and has been struggling with emotional dysregulation, which has hindered their progress. They often experience tearfulness, anger, and confusion during sessions and find it challenging to identify and manage their emotions. In this situation, the therapist should A. Encourage the client to focus on self-care practices activities. B. Collaborate on developing coping strategies to assist the client in managing their feelings. C. Utilize a structured therapeutic method to assist the client in enhancing their emotional regulation skills. The correct answer is C. Question number 3. During the initial intake with a family, the 6-year-old tells the social worker, "I need to tell you something," but another family member says, "Be quiet." The social worker attempts to assist family members in having an open discussion, but is unsuccessful. To increase open communication, What should the social worker do next? A. Understand the initial symptoms reported by the family. B. Have a one-on-one conversation with the youngest family member to ensure their safety. C. Employ questioning methods that involve all family members in the conversation. The correct answer is C. Question number 4. A female client with a history of self-harm and impulsivity is scheduled for a therapy session. The social worker has been utilizing dialectical behavioral therapy intervention for several weeks. During the session, the client becomes upset and starts expressing suicidal thoughts. In this situation, the therapist should A. Continue with the session, as the client has used self-regulation techniques to decrease her symptoms. B. The social worker should monitor her current symptoms. C. Acknowledge the client's thoughts and feelings and develop a safety plan. The correct answer is C. Question number 5. A client enters the room, her eyes filled with guilt and longing as she shares the deep remorse she has carried for years after giving her child up for adoption at 21. This overwhelming burden has haunted her every day. Sensing her pain, the social worker invites her to express her thoughts as if her birth daughter is in the room. What type of therapy model is being used to address these emotions? A. Gestalt therapy. B. Trauma-focused therapy. C. Cognitive behavior therapy. The correct answer is A. Question number 6. You are meeting with a client who was diagnosed with depression. The client mentioned that she ran into a college friend at a grocery store, but the friend didn't acknowledge her. The client feels distressed and says, "Did I do something wrong?" You recognize this as an automatic thought and work with the client to change their perspective. What type of therapy model are you using in this scenario? A. Cognitive behavior therapy. B. Solution-focused therapy. C. Narrative therapy. The correct answer is A. Question number 7. A short-term problem-solving approach is used with a client who is seeking housing. The initial phase focuses on setting up initial tasks, while the middle phase involves evaluating the outcomes of tasks and identifying obstacles to achieving those outcomes. Lastly, the termination phase emphasizes what the client has learned or accomplished. Which of the following interventions is the social worker using? A. Solution-focused therapy. B. Cognitive behavior therapy. C. TFCBT. The correct answer is A. Question number 8. What is the primary distinction between cognitive behavior theory and dialectical behavior therapy? A. CBT is used to treat borderline personality disorder, and DBT is used to treat depression. B. DBT is based on CBT, but with a greater emphasis on managing emotions, including emotional and social aspects such as accepting pain, managing emotions, and acknowledging the reality of experiences. C. CBT focuses more on internal thoughts, whereas DBT focuses more on external behaviors. The correct answer is B. Question number 9. Which therapeutic model emphasizes the active involvement of the youth's parent in both individual and joint sessions? A. Task-centered. B. Play therapy. C. TF-CBT. The correct answer is C. Question number 10. A social worker meets with a military veteran who has been diagnosed with post-traumatic stress disorder. During the initial intake, the client's eyes glazed over as he talked about his deployment. The client's gaze became distant as he vividly described his deployment, revealing the profound impact it had on him. He speaks in a steady, flat voice while leaning forward in the chair and gazing over the social worker's shoulder. What should the social worker do in this situation? A. Allow the flashback to continue and help the client express his feelings. B. Use grounding techniques to help the client reconnect with the present moment. C. Evaluate the client for any signs of suicidal behavior. The correct answer is B. Question number 11. A social worker in private practice is using a very structured treatment model that includes mindfulness activities and instructions to contact the social worker if clients have any thoughts of self-harm. What model is the social worker using? A. Dialectical behavior therapy. B. Solution-focused therapy. C. TF-CBT. The correct answer is A. I hope you found this lecture helpful. If you liked our video, give us a like and subscribe to our channel so you can be notified when we post new content. Please post a review on the comment section. Visit our website to register for our live workshops, study guide, individual tutoring, mock exams, and social work exam prep program. Thank you for your time and have a great day.